National Primary Healthcare Development Agency has released the details of how the first batch of COVID-19 vaccine doses will be distributed across the state. This was disclosed during a webinar organized by the National Primary Healthcare Development Agency sensitization meeting, which is tagged sensitization meeting with media gatekeepers on COVID-19 vaccine introduction. Vãçç Shuaib, executive director of the agency, had said the country will receive 100,000 doses of the Pfizer BioNTech vaccine at the end of January. Vãçç Okposen, program manager, National Emergency Routine Immunization Coordination Center, and the agency, during his presentation at the webinar on Friday, said the vaccines would be administered around the last week of January or early February. According to Okposen, states with higher percentage of confirmed cases would be given additional doses. He also noted that frontline health workers would be prioritized, while other batches would be administered to the elderly and vulnerable persons with comorbidities based on the World Health Organization guidelines. He said we have other sources of vaccines that are non-mRNA, like the COVAX vaccine. The country and other stakeholders are working towards how they can get additional vaccines from the other countries like Russia and USA, Okposen said. We want to assure all Nigerians that the vaccine is safe and effective. The vaccine will be introduced in 4 phases, and this is due to the availability and quantity of the vaccine that will come in at any given time. When the vaccine arrives in the plan, there is going to be the prioritization of persons to be given the vaccination so as to optimize the available sources and vaccines that will be received, and this will be based on global best practices. All the time, global best practices. In the first priority, when the limited doses first come in towards the end of this month and early February, will be the frontline health workers like immigration, airports, police and military on essential duties, those working in the labs and other medical practitioners. Those states with higher number of cases will be given additional doses. We've mapped out the health workers in each state and locations where these vaccines will be deployed as soon as we receive them. All the states in the country have cases, and we need to get the vaccine to them all if we want to achieve herd immunity. According to the data shared by the group, the agency, Kano, Lagos, Katsina, Kaduna, Vãçç, and Oyo will receive more doses for health workers. The breakdown is as follows: Kano 3,557, Kano 3,557, Lagos 3,131, Katsina 2,361, Kaduna 2,074. Vãçç will receive 1,900, Oyo will receive 1,848, Rivers will receive 1,766, Jigawa 1,712, Niger 1,558, Ogun 1,473, Sokoto 1,468, Benue 1,423, Borno 1,416, Anambra 1,379, Kebbi 1,361, Zamfara 1,336, Rivers 1,000, maybe Cross River because we've talked about it, Rivers 1,306, Imo 1,267, Ondo 1,228, Akwa Ibom 1,168. Others are Adamawa 1,129, Edo 1,104, Plateau 1,189, Enugu 1,088, Osun 1,032, Kogi 1,030, Cross River 1,023, Abia 955, Gombe 908, Yobe 842, Ekiti 830, Taraba 830, Kwara 815, Ebonyi 747, Bayelsa 589, FCT 695, Nasarawa 666, He also stated that the federal government intends to administer the vaccine to at least 40% of Nigerians in 2021 and another 30% in 2022. In 2021, 40%, they will reach about 40% of Nigerians, while in another 30% in 2022. Oh, sorry, 2022. Okay. Okay. Also speaking, Kabura Dadara, Director Logistics and Health Commodities NHPCDA, said the federal government will not release the vaccine to states until facilities such as cold chains are in place. Dadara said the vaccine must be administered within 5 days of receipt for it to remain potent, and only the states that show commitment would receive the doses when available. She added that the 100,000 doses would be administered to 50,000 people because each person has to take a second dose 21 days after taking the first dose. Okay. I'm sure you all heard what the arrangement and how they want to go about it. Nigerians will talk, and they are making sense in most of the things they say. They make sense because what you never thought of, that is what they are going to be bringing some facts from the whole thing. Between Lagos and Kano State, which of them have the higher cases? Why should Kano get more, and why should 3 states from northwest be prioritized above other states? Someone says, you've not seen anything. That is why the North wants the support of satanic politicians to support them to get power at all costs. I still don't understand the formula they use. Lagos is an epicenter. The whole saga begins from Lagos. Exactly, and up till now, the Lagos has been the most receiving. They are the receiving end. And this, I don't know, even from the North, we didn't hear much about this so-called COVID-19. We didn't hear so much. It's just between FCT, Lagos, and Oyo. Not even Oyo. Ogun State. Ogun State is even closer to this, so they are interwoven. Ogun State and Lagos State. Well, Niger, that is Niger for you. Nepotism. These states are dominantly Fulani, so you can understand. As for me and my family, we will not take the vaccine. Keep it as they should keep it as they kept palliatives. Do not take vaccine. Hope the vaccine will go the way of the palliative that was distributed during COVID-19. Because it is vaccine, you want to give it out freely. If it were to be money, would you have given it out like that? Did you give out palliatives? Oh my goodness. Did you give out palliatives? Did you release grants to the citizens? How come you include Kogi State in the sharing formula when we have no single case of COVID-19 in the state? Una won't give us COVID-19 by force. Hope Buhari will take first. Politically determined instead of using the figures of infection per state as ratios in sharing, at least in the first instance. Of course, Lagos and I can really relate with the Lagos and Kano states. Yes, Lagos and Kano. The whole thing is just somehow. Well, so guys, let's hear your opinion and let's know your thoughts on this. Thank you.